Okay, now we got it.
Right. So, yep, there you go. Yeah, now it's recording. Okay. All right.
We're
Thank you,
good
Mr.
to go.
Christopher.
Okay, so Mr. Cruz, you have the floor. Will everybody else please mute themselves, and I will also, and when he will introduce Ms. Barada. Thank you. Go ahead, Adolfo.
Thank you, Carl. I'd just like to say good evening, everyone. And first off, I'd like to thank the Bronx Community Board for giving us the opportunity to present. My name is Ed Cruz. My full name is Adolfo Cruz, but everyone calls me Ed. And I am community liaison worker for Gotham Health for the 5 boroughs. As a community liaison worker, I am tasked with the responsibility of raising awareness for affordable, quality health care to the community members and small businesses in the communities, giving people the opportunity to connect them to medical services, whether they have health care insurance or not, whether they're undocumented or documented. New York City Health and Hospitals, Gotham Health is here to help. With that being said, I would like to introduce my colleague, Ms. Marlena Beretta, Director of Ambulatory Care Services at the Gotham Health Gun Hill Road site. Ms. Marlena?
Good evening. Let me just try to share my screen with you guys. Can everybody see my screen? Oh. Can everybody see?
Now we can, yes.
Okay. So hi, my name is Marlene Barada 40, and I'm the Assistant Director for the Health Center at Gun Hill. So my presentation tonight is going to be basically about the Gun Hill Health Center and the services we provide for you guys. So our practice is located at 1012 East Gun Hill Road, in the Wakefield section of the Bronx. So who we are. NYC Health and Hospitals is the largest public health care system in the country. Gotham is the ambulatory arm of the NYC H&H network of federally qualified healthcare centers created in 2015 to address the primary and preventative care needs of families and individuals in their own throughout the 5 boroughs. This consists of 6 large diagnostics and treatment centers with 20 smaller neighborhood centers, which is Gun Hill. Gun Hill is one of the smaller centers that Health and Hospital has. We deliver high quality healthcare with compassion, dignity, and respect to all New Yorkers without exception, and to also promote healthy lifestyles to the community. Gun Hill was open, well, where Gun Hill is now physically standing was opened in May of 1999. And like I said earlier, conveniently located in the Wakefield area of the Bronx. Gun Hill continues to adapt innovative health strategies to facilitate positive patient outcomes. Our patient satisfaction scores are among the highest in the organization. The hours of operation at Gun Hill are Monday, Tuesday, Thursday, and Friday from 8:30 a.m. to 5 p.m. On Wednesdays, we're open from 8:30 a.m. to 7 p.m. And we're open every second Saturday of the month from 8 a.m. to 2 p.m. So what's Gun Hill? What makes us a little different from all the other sites? Gun Hill is a family medicine practice. So we see adults and children, OB, we have social work services, we have pharmacy services for chronic care disease patients. We do family planning, we have financial counselors on site, as well as a Metro Plus representative that is able to enroll patients in health insurance. And we also have a chronic care program that helps patients manage their diabetes and their hypertension. So staffing to reflect the community. A lot of our staff, Gun Hill looks like the community. Our staff, we speak the language of the community. We have many languages that we speak, so just to name a few, but not limited to, because we also have an interpreter service line that deals with many languages. But at Gun Hill, physically, we have staff that speak Spanish, English, Tagalog, Ibu, Akan, Twi, and Creole. And for those that don't speak any other languages. We have the language line that has 100 languages and dialects. Who we see, just like Mr. Cruz said earlier before, we see everybody, regardless of their immigration status, their ability to pay. We accept most insurances and offer discounted fees for uninsured or underinsured patients. And we offer discounted prescriptions, which are, it's for the patients that are underinsured or not insured with the fee scale program. And there they'll go to one of our sister sites, and that's where they could get their prescription at a lower price. And like I mentioned earlier, we have financial counseling on site that helps the patient with any needs they need if they're uninsured, as well as the MetroPlus representative. And I'm not sure if you guys know about NYC Care, but it's part of an initiative that Health and Hospitals and Gotham has created to help patients have more of a insurance kind of fee scale, which will give them a card and they can see their PCP and it has their PCP names on it, and they can feel more one-to-one with their provider. So the support beyond healthcare, the facility and the outreach team are very active in the community. We have a reach out and read services for the children, and we also have social work services that connect with other sites and other services. This is just a little bit about how the patients feel about us. They're always very happy to have a practice that they can come to and relate with us and feel like they're at home. And last but not least, this is how the front of the health center at Gun Hill looks. And this is our number to make appointments. So if anybody needs to make appointments, they just call this line. They'll get the call center, or they'll actually get somebody live at the practice that can help them schedule an appointment to see a primary care provider. That's the end of the PowerPoint.
Does anybody have any questions? This is, it's on Gun Hill Road between Paulding and Hone. It's
Yes.
just next 2 blocks past Barnes, I guess, going east.
This is,
On Gun Hill.
yes, right on Gun Hill, yes.
Okay. Now, so from what I'm getting, you're just a healthcare facility, not just, but it's a healthcare facility. Anybody could, you take walk-ins, or you have to call in for an appointment?
Yes, we do accept walk-ins. We do schedule appointments for patients, but of course, if you have any sick patients that come in to the practice, we do our best to accommodate the patients. You know, they get triaged by the nurse, and then we go from there, because sometimes the patients don't really need to see the provider the same day. So it depends on what they're coming for, but we do accept walk-ins, yes.
And we
And
are
also-
You're more than an urgent care, though.
Well, we're not like an urgent care because we're a family practice. So we're like more primary care. You have your actual piece. Every time you come to Gun Hill, you see your doctor. So if your doctor is Mr. Flesher, that's who you're seeing every time you come to the practice.
Yeah, we're more preventative care also.
Yes. I think
Yeah.
somebody else wanted to say something.
Yeah, this is Nicole Roberts. I'm the assistant head nurse at Gotham Gun Hill. So although we do accept walk-ins and our panels are built out where we do have slots, same-day slots available, so that we can accommodate as many walk-ins for that particular day.
Okay. So if I need a doctor, this would be a place to go, especially if I live in that neighborhood.
That is correct.
I would go. You'd probably assign. I'd see a nurse, triage. They'd probably assign me a doctor, which might be a general practitioner, which would be my regular doctor, and you have specialists that you can refer me to, or a patient to. Is that correct?
Yes, that's correct. So at Gun Hill, the providers see children, adolescents, they see adults, and we see OB and GYN at the actual site. If you need any specialty like a podiatrist or ophthalmology or something like that, that's when we refer you out.
Okay, do you use any particular
Within
hospital?
H&H. Within H&H, yes. So we can refer you to any H&H facility. We try to refer to Morrisania because that's our FQHC, or we'll refer to Jacoby or North Central because those are the two acutes that are closer to our practice.
They're closer than Montefiore?
Well, North Central is right next to Montefiore, but those are our H&H hospitals, so we will refer to
Oh, okay,
hospitals
H&H.
organization. Yes.
okay. Because I know doctors have to be connected to them.
Yes.
Very good. Thank you very much,
You're
Marlene.
welcome.
Any other questions?
Yes, I'd just like to find out what sorts of providers do you use in the facility?
What do you mean? What kind of providers do we use?
Do you use mid-level practitioners?
So we have MDs and we have NPs. And we also have, at this point, we have a fellow that she's working with us. And one pediatrician that he's actually just a pediatrician.
Dr. Burke?
Not a problem. Thank you,
Dr.
Ms. Lozano.
Dr. Oh,
Right, yeah. So my question is, well, actually, it's more of a comment. Is that you said it's in the Wakefield section. Actually, you're in the Williamsbridge section.
oh, Williamsbridge. I'm sorry.
Right. You said Wakefield, but Williamsbridge,
Yeah.
but that's okay. Let me ask this question. I mean, I guess everybody's asked about providers per se. So I won't ask that question, but I will ask about the vaccinations, because as you know, in this particular area of the Bronx, we have a low vaccination rate. So please tell me that you guys are offering COVID vaccinations at your site.
Not at this time. Not yet. Not yet. So there's a pilot going out, and we're probably going to start giving out the vaccine to children between 5 and 11. But as of right now, we're not giving the vaccine out. We'll refer them to one of our acutes or one of our FQHC.
Okay, now what is FQHC?
Federal Health Qualified Centers.
Okay.
So like Morrisania, Belvis, Bouvier.
Right, but I'm just saying because everybody doesn't know what that acronym
Yeah.
stands for, so that's
Okay.
why I asked what FQHC is. Okay. Okay.
But soon, we're trying to get there. You know, we have to wait for Gotham to give us the okay and
Let
get.
me ask this question, because you have a variety of providers. I guess my question is, because that is a small site, as you stated in your presentation, do you have, like, is it rotating, like one day you may have a pediatrician, one day you may have the OBGYN, one day you may have the general practitioner, or can you fit at least 2 or 3 practitioners in your site at any one time?
Oh, we have a pediatrician every day. And most of our doctors are family medicine. So that family medicine provider will see a pediatric, an adult, and an OB. So her schedule or his schedule can be, it's any patient that we will put on the schedule. It's not really modified to Mondays we're doing OBs, Tuesdays GYN. No, every day we see all the patients.
Okay. Now, you didn't give your hours of operation either. I don't remember hearing that in your presentation.
Oh, I did.
Oh, did you? Okay. If you did, I apologize. So
It's okay. We're open, and I'm just gonna put it again. We're open
yes,
Monday,
okay.
Tuesday, and Thursday. Monday, Tuesday, Thursday, and Friday from 8:30 to 5 p.m. On Wednesdays, we're open from 8:30 to 7 p.m. And every second Saturday of the month, we're open from 8 to 2.
Okay. All right. Thank you.
You're welcome.
And just going back to the vaccination question, although we are not currently doing COVID vaccinations, we do do the other vaccinations for the entire family. So pediatrics, adult, plenty of vaccinations are given at Gun Hill.
So what type of vaccinations are those?
For the children, we have DTaP, polio, combination vaccines like PDRX, Kinrix. We give, for the adults, we have Tdap, we have MMR, varicella. I believe we have every vaccination that children need the series for, and what adults may need to.
Well, that's what I was about to say. So in other
Mhm.
words, if I have a child that needs to enroll in school,
Mhm.
and what you're telling me is I can bring them to your facility, whether an appointment or not, and I can have them vaccinated so that they can attend school.
Yes, they
Okay,
can come and get vaccinated.
excellent.
Are there any other questions? Would any of the guests, Ms. Reyes or Mr. Paulino, be interested in making a presentation on your own, about your own group in the future? I think that's a no.
No, no, I'm sorry. Yeah, I'm actually here on behalf of the Department of Social Services along with our Deputy Commissioner Aaron Drickwater to talk about the shelter at 1591 East 233rd Street. So we're next on the agenda whenever you're ready.
Okay. All right. So you're going to speak right now then, Mr. Paulino. Is that it? Because I wasn't aware you were on the agenda. That's what I'm saying.
No, so Mr. Lanzano, so like I said, so they're on the agenda because this is, so let me just introduce this if I may, because I have a little bit of insight into this. So,
Yeah.
you know, Commissioner Drinkwater, you know, I'm sure you're a nice person, but I'm not happy to see you again, but I am happy to see you nonetheless. So what we have here is, if you remember back, I want to say in 2019, there was actually, yeah, I want to say 2019, 2020, I can't remember, but I know in 2019, this was actually mentioned, but it actually came to fruition in 2020, and it was discussed at the executive committee meeting where the old provider made a presentation to the executive committee regarding opening a shelter, a women's shelter. So the men's shelter was not, well, the men's shelter, both shelters were supposed to go into Assembly District 83. However, the speaker did not want the men's shelter, but approved the women's shelter at the time. And so that's why the women's shelter is coming in. Now, if you remember, there was a lot of, and again, I invite you to go back to the executive committee meeting, I want to say in January, February of 2020, for some insight. But there was a lot of consternation regarding another shelter because this particular shelter was being built in MIH district. And again, former Mayor de Blasio made all of these populars. And so I think if you remember me saying this at a general board meeting, the speaker at the time was of the opinion that, you know, we need to pick our battles, and thus we also needed to, you know, not turn away the women and children. And so,
Excuse me, Mike. Let us finish with Gotham first, and then we'll move on to this, okay?
oh, I thought you were done with them.
Well, I just wanted to see if anybody had any more questions, and if there aren't, we'll move on to Mr. Paulino. Would that be okay, Mr. Cruz and Ms. Barata? Do you have anything else to say?
No, I think Ms. Beretta covered everything. Just like to say that we do have other sites in the Bronx, a newly opened facility on East Tremont and Webster Avenue that also have specialty services that some facilities in the Bronx may not have, which is pulmonary and cardiology at that site. And that's a brand new site opened because of the COVID pandemic. One of the centers of excellence that Mayor de Blasio had promoted on the news. So that site is now open and accepting patients. Also, we have the Morrisania site, and we do have the Belvis site also in the Bronx. And like Ms. Moretta said, we do have relations with the Jacoby Hospital and the Lincoln Hospital sites, where we refer patients to when we cannot have the services available at the Gotham clinic sites.
Okay, thank you very much. I appreciate you coming. With
Thank
that
you for
said, we'll
inviting us.
move on to Mr. Paulino. I'm sorry, I hadn't looked and see if that you were added onto the agenda. Dr. Burkett, you could continue now explaining the issues.
Okay, again, I apologize. I thought that we were done with the other ones, but yeah, all I was saying was that so that's how they're here. So as you may or may not remember in the news, there was something that went on with the provider, and so the new provider is here, and thus that's why they're here. So Department of Social Services, as you know, is one of the ones who sponsors the shelters, and so they're here. That's why Commissioner Drinkwater and her team is here. And as I said before, this is one of the sites that the speaker gave his blessing to. So to that end, that's why they are here with the new provider, who I do not have a history with, but nonetheless, they're here to present to the Health and Human Services Committee.
Thank you, Dr. Burke. Deputy Commissioner, not Commissioner. Nice to see everyone tonight. We wanted to take the opportunity to return to the committee, as was just laid out. We did announce on the shelter back in 2019. At the time, the agency and the social services provider made a presentation to the board about the project, the services that would be available on site, and so forth. And with the evolution of the project and the new provider, we wanted to be sure to make an introduction to the committee and provide an opportunity for the committee to learn firsthand about the new provider and the work they intend to do for the 200 women who are experiencing homelessness on the site. As with all of our projects, we will have a community advisory board and certainly welcome input from this committee and the community board as a whole for participants to be a part of that community advisory board. As this board is well aware, our community advisory boards are really critical in making sure that we have a good working relationship with the surrounding community and neighborhoods that we will be a neighbor to and a neighbor from. So with that short introduction, I will turn it over to our provider to kick us off and just give a quick introduction. Nadia will do that, and then myself and my colleagues Sonia and Eric will be here for any questions that the committee might have.
Great. Hi, everybody. Again, my name is Nadia Sedlowski. I am the Chief Program Officer at Community Housing Innovations. We often use the acronym CHI. So if you hear me refer to CHI, that is us. CHI has been around for about 30 years. We were founded in 1991. We are a non-for-profit housing and human services organization. We currently have sites in Nassau County, Suffolk County, Westchester, Orange, and Dutchess counties. And then this is our first, but not our only foray into New York City. Just to give you a little background, our CEO has extensive history in the shelter market in New York City, as do I, as does our Chief Operating Officer, Lenny Smith, who is also on this call. We provide a variety of housing services, all the way from emergency housing programs, such as this one, to supportive housing, to affordable housing. We also offer first-time homebuyer grants. We offer foreclosure assistance and eviction prevention assistance as well. Currently, we house in our emergency housing and permanent supportive housing over 1,000 individuals every single night. We have contracts with OTDA, our local Department of Social Services, OMH, now New York City, and we had some HUD housing as well. I'm trying to think if there's anything else that I think would be pertinent to this call. We do operate certified OTDA shelters, so there is a rigorous process that we go through between our local governing body, which in this case would be DHS, and the state OTDA, the Office of Temporary Disability Assistance. We get regular inspections. We're in very good standing with the state, and we really aim to provide the highest quality services that we can, and we have a motto that we wouldn't want anybody to come into one of our shelters that we wouldn't stay in ourselves. So we really hold ourselves to a very high standard.
Great, thank you, Nadia. And maybe it would just be helpful for the board to hear a little bit about what a day in the life of a client on site would be like, the type of social services that are available, as well as the work that you all do to make offsite connections. That would be helpful, and then we can open it up to the board, I think, for questions.
Sure. So this site will be offering, as all of our sites do, case management. So each individual that comes into our program will receive an intake within the first 24 hours of them entering the facility. The intake goes through a lot of questions with our population, making sure that we understand if there are any pressing medical, mental health, substance abuse needs that are currently unaddressed and need to be addressed immediately. We do individual and group counseling. There are going to be LMSWs on staff. We obviously are a homeless shelter, so our big focus is also on housing and helping our clients find permanent housing. We do referrals for medical, mental health, substance abuse. We try to do linkages with our local community providers and MOUs. We work with our clients on independent living skills. So once people move into out of emergency housing, that's only step one, right? We want to make sure that we have prepared people for independent living so that they do not come back into the shelter system. So again, it's making sure that those linkages are in place, that if they need medical care, that we provide them with a connection while they're with us, but also then that they have a connection once they've left our program. We'll be offering education and vocational assistance, referrals for GED classes, vocational classes, and then also just general living skills around budgeting, paying bills on time, apartment maintenance. One of the things I remember when I first moved into my very first apartment was honestly trying to figure out how to change a light bulb in one of my lamps, because I didn't understand that you had to pull it down and then you had to get the light bulb. So just kind of like things that you don't always know when you're moving into your own place for the very first time. Again, our goal is not just to get people into housing, but to get people into housing and out of the shelter system permanently. We will have a 24-hour staffed program. There will be a minimum of 3 security staff plus a shift supervisor on each shift. There are going to be 80 security cameras throughout. We will also be doing perimeter checks. We believe in being good neighbors. We have great relationships with all of our community partners now, and we don't see that changing now that we're coming into a new area. Our front desk will be available 24/7. So if there's ever any issues, you can call our front desk. Somebody will answer that phone. You will speak with a human being, and we will make sure that we address any issues. And one of the other things that we're looking forward to bringing to the community is about 60 full-time jobs. Our HR team will be coming out to do a job fair in the community so that we can do direct recruitment with people who live in the area.
Thank you, Nadia. Dr. Burke, are you leading us in Q&A?
That should be Mr. Lanzano would do that.
So I will. Does anybody have any question?
Actually, I do, Mr. Lanzano, but I kind of want to hear from everybody else first, if they have any.
Okay.
If not, then, so I guess my my thing is, again, I will say that I echo the speaker's position on this, in that, again, I'm not anti-shelter. This is me speaking personally. This is not for the board. I'm not anti-shelter, and in particular, women and children need a place to stay. In that, I remember when I was teaching at one of the colleges here in the Bronx, one of the community schools, in which one of my former students actually had to enter a women's shelter due to what was going on in her living conditions at the time. So I'm not anti-shelter. I think the problem that I'm having is, I think the location is near some unseemly establishments, if I can just put it mildly. So I think the problem that I have is not with the shelter itself, but the location. I mean, I understand it's done now, and I think I remember Carla Brasati, who was on this call, was actually sitting next to me when we were in those meetings having that. And so, so my question is and again, I don't know who wants to answer it. What are you going to do to make certain that you protect your residents? Because we are talking about women and children that are going to be in this facility. What are you going to do to make certain that you protect your residents from the unseemly nature of not only the location, but some of the clientele that may almost like prey upon vulnerable women and children? So that's still a concern of mine. And so if someone could take that out, appreciate it.
So let me just say that there will be no children at this site. This
Sorry, I
site
realized I was on mute.
solely, I don't know if I was muted, but this site will operate solely for women. It will not have children. Everyone that will be at this site are women over the age of 18.
That's right. And to your question about, the work, I think when we open sites, we communicate to the local precinct just as a matter of introduction. So that way the precinct is aware. It sounds like they would be the entity to address any behaviors that are going on outside of the shelter that are illegal. As it relates to the work that the provider is doing, that work is occurring inside the shelter. We do have clients sign a good neighbor policy, wanting to be sure that our clients do comport themselves in the community in a way that is in line with the good neighbor policy.
Could you just refresh what the address is again of this facility?
I believe it's 1591 East 233rd Street.
That's right.
Say it again, please.
1591 East 233rd Street.
And what's the cross street on that?
Can't
Merritt
say.
Avenue.
Can't remember.
Merritt Avenue.
Barrett?
It's right near the Dyer Avenue train station. It's within walking distance from the Dyer Avenue train station. Is how I remember it. Because
Okay, it's down by the old milk store there.
Yeah, the old Imperial plant.
Mm-hmm. Correct.
Yes. I have a quick question, Paul.
Yes.
Dyer Avenue. Okay.
Have you guys reached out to any of the local churches or anything to find activities for these women and somehow create a mentoring type program? Because I'm not a psychologist or a doctor or anything like that, but when you somehow put people that are having the same problem together without seeing or having people around with positive attitude, positive ideas, you know what I'm going at, where they need some kind of positive reinforcement in their lives. And I believe if you somehow reached out to some of the local women, could even go in on a weekend and teach them different things, some social things. I don't know, just came.
John, you're spot on, and part of the work that the community advisory board does is to work with local residents, business owners, neighbors to create some relationships, thinking about opportunities for local residents, or as you mentioned, faith-based communities to volunteer and partner with the shelter. So that's something that I can let Nadia speak about at other locations across the city, but that's exactly the type of partnership that we know makes our program successful, and therefore in turn makes our clients successful in transition to permanent housing.
Yeah, because Dyer Avenue at night, you don't want women wandering around those dark streets, and you got the sex shop there and all that stuff going on. Around there gets a little quirky. So just want to have some good things.
Thank you for that. And as a reminder, all of our shelters have a 10 p.m. curfew. So the women will be inside by 10 p.m. If women are working, we do provide passes for them to come in after curfew. But I'll let Nadia talk a little bit about the partnerships that they have with community organizations.
Sure. Yeah. And I was going to say the same thing. So there is a curfew. All of the clients are expected to be inside at 10 o'clock at night. And then we also do, a head count, which gives, if we were to see, and to address some of your concerns about the interactions that they may have, anybody who's walking through our front door, there are going to be people who are able to assess whether or not that individual may be under the influence. Is the person coming in with any bruises or anything of that nature, which we would address. We do not allow guests, so nobody would be able to come into the facility with the women. And in terms of the partnerships that we have, again, this is going to be the first program that CHI is opening in New York City. But I, again, have had a long history of working in emergency housing in New York City, and always partnered with local community groups, local faith-based organizations, because you're absolutely right, to engage our population, to make sure that they are working on, we've had people come in and do tutoring. We've had people come in and do art classes. We've had people come in and really just enhance the services that we currently provide, even to do some fun recreational work, because we don't want it to just be, kind of all work all the time, all focus, Everybody needs a break every once in a while. So to have people come in and also do fun and engaging things, it's a way for our clientele to also connect with the community, and be a part of the community.
Well, if that's the case, then I'd like to invite, I don't know if they're not there yet, I don't think, are they? Because I know that our Library and Cultural Affairs Committee is going to be promoting their Women's History Month next month. So that's a plug for Mrs. Joan Claude and her committee, and Miss Sadie and their committee. So if your residents are there by then, I encourage them to participate in that. And so there's a question in the chat that Mr. Mike asked. It's like I said, this is Ms. Lanzano's meeting, but the only thing, again, I'm just concerned about, I know you have a curfew, but as Mr. Isaac said, and I've said before, just where it's located. It's just, I don't know.
Good evening, Chairman. I'm sorry to come in so late. For those of you who don't know me, my name is Tarlene Dickerson. I am the chair for the Education and Youth Services Committee, and I also lived in that area. I also was a dean and an assistant principal at schools in that area. And my question before Mr. Isaacs had his question, our chairman, I just wanted to know, had any of you or had anyone been over there at night? Have you spent any time to go over there at night?
So
Because
I'm going
it
to say
is.
yes. I'm going to say yes, I have, because I'm from that area. My
Okay.
daughter, I raised my daughter in that area near in Co-op City. So oftentimes we have had to be, visiting friends or relatives that also live in that area. My mother still resides in that area. So I'm very quite familiar with that area. And I visited there as early as Friday just to get a sense of what the site looks like while it's undergoing construction.
Friday, what time of day, if I may ask, please?
The last time, well, I was there Friday in the morning time, but as I've stated in the past, before that building came into place, I have been over there as I don't, really don't want to put too much out there. At a 2 a.m., 3 a.m. hour,
No, not a problem, not a
So,
problem.
yes, I am quite familiar with the area.
Fortunately, we're all grown.
You.
I used to be the dean. You won't be in any trouble, I promise you.
I appreciate that. Thank you.
But see, my concern, I mean, what I've experienced most of the time that I've been in the area, there is, and I don't know if it was addressed, I'm sorry, I got on a few minutes late. There's a very heavy prostitution, very heavy drug use. And if you know anything, we've always had a problem with the truckers. You know, they park over there, they know that's the place to go. The hotels over there. And like I used to explain to people about my students, I say, if we don't give them something to do, there's somebody that will give them something to do. Okay. And what I've noticed, I mean, it's like getting off the train. People try to completely avoid Dyer Avenue, avoid going over in that area. So as a woman, as a person with children, as a grandmother, I mean, I just need you all to really be very, very conscious of what you're doing in terms of bringing young women, middle age, however old these women are going to be, in that area, and making sure that they are safe. Because there is somebody over there, I promise you, waiting.
So let me just say, you might not have been on the call, but my name is Sonia Russell. I am the Assistant Commissioner over Adult Families and Veteran Services, in addition to over the CHI portfolio, which is new to my portfolio. I have been doing this or worked for DHS since my daughter was in pull-ups on taking the Dyer Avenue train every day to work. She is now 25 and she is a social worker herself. So I say that to say I've been doing this for a very long time, and I am very much committed to addressing the issues that you raised. So having been at the site Friday, and even though I was there in the morning time, there was some things that I've mentioned to the young lady, I forget, Nadia, about what, perhaps we can do. I noticed that maybe we need to have the underbrush under the L cleaned out to see whether or not there's lighting there that perhaps we can help assist in getting for the women. But I will continue to work with the program, and I go out to my sites at least once or twice a month. I'm very much involved with my programs that I oversee, again, just to ensure that we are offering the type of services that the women need, in addition to ensuring that we are good neighbors to those in the area in which we are, the women are living in. So I appreciate your comment and your candor, and understand that we absolutely are committed to ensuring that our women get the best services and that their safety is of the utmost priority for us. Because again, I am very familiar with that area. I have been there at the wee hours in the morning in my early age. So I know exactly what it is that you're saying when you talk about, what's out there. So we will be continuing to have ongoing conversations with CHI once that shelter is fully operational.
Okay, because I know we did. I appreciate what you said, and my thing is we did a lot trying to take care of the whole situation. And I hate to, like, if anybody on here is a trucker or has any truckers in their family, I don't want you to feel like, but it was a real problem. There was no way, not all, but I mean, it was unbelievable to see, what was going on. And just feel, with me, the type of person that I was, to feel like you just want to grab, come on, honey, why don't you come here, honey, it's amazing. So I just need everybody that wants to be involved with this to spend time like you did, or like you're aware, like I'm aware, like all of us who live in this community are aware. I need you to come spend a little time. Come over there at night. Come on, I don't want you to come and get hurt, but maybe you come with some other people. Maybe you come sit in your car, buy some coffee from the little Dominican spot right there, and sit in that car. They got the best coffee in the world. And sit in your car. If you lock your door, go to the deli. It's just, I'm begging you, to please take the time and see what exactly is going on. During the day is a whole nother story. The precinct, the representation is a whole nother story over there during the day.
I actually live right up the street, and I think this summer we had there were a couple of violent incidents over there. There were shootings and stuff over there. I remember one time I had to go pick up my wife from the train station, and I thought I was like in Baghdad or something with like cops, and I had to literally stop on 233rd, and she had to walk down the block. We couldn't even enter Dyer Avenue. So it changes at nighttime down there.
Thank you. That's very helpful information, and we will be sure to follow up as the Assistant Commissioner said, and as Nadia referenced as well.
If I may, I'm Lenny Smith from Community Housing Innovations. I am quite familiar with the area. I've been there at night. I've been to Olivet Church. And I've also been to Bible Truth on Merritt Avenue. Olivet is on Dyer. I will agree, and I can concur that there is that adult establishment on Connor Street. But as Nadia had said, we're committed to working with the community, and we will do everything within our power to ensure that the women are safe, and our facility is safe and secure. So, I did raise my hand. I don't want to speak out of order. Good evening, everyone.
Go ahead.
Yes. Hi, Carl. How are you? This is Maisha.
Hi,
everybody.
Good to see you again.
Good to see everyone. Hi, Alita. Okay, so I am committed as a resident of Community Board 12 to be a part of whatever advisory board you have for the shelter. I think that that is what is needed, a strong advisory board. We are talking about women. I don't think Community Board 12 is a NIMBY, quote unquote, community. We understand that we're here to serve, but we want to serve in the right way. And I'm also committed to identifying people in the community that can serve on this advisory board. So I will make sure that we can connect and we can create a robust advisory board because the shelter is coming and we don't want to make no mistakes about that, but we want just to make sure that our community needs are being met as well as the needs of these women that are coming into this community and being able to really serve them the way we should as well. So that's just my takeaway. Hi, Carla. Yes.
And thank you for that. We really appreciate the interest in the community advisory board, and also just the questions and inquiries and that have come up on the call tonight. Again, these are the types of exchanges that make our programs stronger and the relationship that we have with the community, like we said, for us to be good neighbors, and in turn then for us to make sure that we're providing support to women who are in need of our services as well. So we can certainly follow up to make sure that you get information about the Community Advisory Board. Jocelyn Bennett, who's also on my team, if she can just drop her email in the chat, you can reach out to her about the CAB. The shelter is slated for a target date open of April. I say target because DHS on our own, we don't open the shelters. We have to go through a series of review processes with Office of Temporary Disability Assistance, making sure that our occupancy certificate is in order, and a number of other things. So we are slated to open in April. If that timeline does shift, we will certainly provide the board an update. And then the first CAB meeting will happen shortly thereafter the opening, because we recognize that establishing that line of communication immediately is really helpful.
So this facility is going to be occupied in early April, you're saying?
That's what we have for the target open. That's correct.
Right. And we have already sent a letter that we approve the facility.
So shelters are not subject to land use actions, ULURP, or community board approval. They're as of right projects. We always do welcome if the community board wants to issue a statement in support of the shelter. That's always welcome, though not necessary. And then we're always committed to working with the community board on any issues that might arise. Concerns that are raised can either be directed to the agency, but also our provider will have a direct line of communication for the community as well to resolve any issues that are happening.
Well, the usual procedure was, though, that the Bronx Borough President mentioned to us that the facility was going to be started, and that the community board should go, look at the facility, make our recommendations, then talk it over and write a letter whether or not we think that it's a good idea. In several cases, as Mr. Burke pointed out, facilities were put up where it wasn't safe for the people that were going there. In fact, I was involved with two of them that we did not give approval. We actually went down to, it was a Wall Street area, I forget it. We had a judge over there and we told them why it wasn't safe for these people. I'm surprised that we didn't get first look at this, at least to make recommendations. Yes, I know it's as of right, but it's also a courtesy to the community, because we would like to put these people and help them, and but on the other hand, if we're putting them in a unsafe situation, that's not fair to them. It's not fair to the community.
Absolutely. So just as a reminder, so every year since 2017, DHS sends a letter to the community board and to our local elected officials asking for any recommendations for sites that might be suitable locations for shelter. We consider that one of the ways that we have this conversation around community engagement. And then, as Dr. Burke mentioned earlier, once the provider, and again, it was a different provider at the time, submitted a proposal which was rated and approved, the agency notified the community board of our intent to move forward with the project at this location. In the subsequent passage of time that takes for the development and building of the shelter, as was noted, we're no longer doing business with the original provider. And the new provider who is here with us tonight will be the provider who is operating that site when it opens in April. We would be more than happy prior to the opening of the site to do a site visit with members of the board. You'd be able to meet people, you'll be able to meet staff from CHI, as well as representatives from DHS and DSS. So if the board is interested in that, we would certainly be able to arrange for a small tour of the facility prior to the clients moving in.
I would be interested in that, to see the facility. Usually the facilities physically are excellent, up to code, better than most houses or facilities in the area. However, sometimes it's just unsafe. There was one place that I looked, the neighborhood was excellent. I forget exactly where it was. I know where it is, I won't say. I asked around and they were terrorists. That people said those people, it was for physically disabled. And they said those people, if they were put there, they would be killed, because there were terrorist cells there. People knew about it, they couldn't prove it, and so we refused. We did it to protect those people that are coming. Now, that's the reason we want it. Also, if you have a situation where you have women here and they're put in very difficult circumstances, we would have an issue with that. And they would be in our community, they would be asking for our help. That we don't always have people like Maisha, is willing to go out and stay with them and form advisory board committees with them. But it's just that the courtesy should have been extended. Okay, said my piece. Anybody else on this, Mike?
There's a question in the chat, Mr. Lanzano.
I saw it for Mr. Mike. He asked who.
No, sir, there's another one.
Let me think. From who?
Let me go
Colleen,
back.
I have another meeting, but thank you.
No, this one's from, it says Yell A. What?
Cheryl, so yeah, I saw the question. I'd be happy to respond to that. So Cheryl said, what about aligning with local city colleges to get these women to better themselves educationally? Absolutely, absolutely. Those are the types of community partnerships that we look to do. So, you know, the city colleges, any local schools that might be doing GED, ESL, those are the types of things that we actively look to pursue and engage with. Swimming, among other classes. Recreation is big for us. Again, we want to make sure that our clients are not sitting in a shelter, not doing anything all day. You know, we want to make sure that they're engaged, and we want to make sure that there's a good balance of not just, okay, we're focusing on education, we're focusing on budgeting, we're focusing on getting housing, but here's also something like, here's an art class you can take. Here is, you know, it's really to look at it from a holistic point of view. So thank you for that. And we absolutely will. And if you have any connections in that area and you would like to reach out to us, I will plug my name and email address into the chat. And I'd love for anybody who has a connection with a local resource to please reach out, because we would be very, very interested in partnering.
Okay.
Just to quickly say, I'm sorry, this is Tarlene again. I put my information in the chat as well. Okay.
Thank you. I wrote it down.
Awesome.
So I just want to say this comment is to, I think his name is Mr. Burke. I think you asked a question to Gun Hill Gotham, regarding vaccination and or COVID testing. So please know that at this particular shelter, we will absolutely have testing and vaccination available for all our women. We do that for our shelters at least twice a month.
Well, thank you, Ms. Russell. Actually, it's Dr. Burke, but that's okay. I just want to say this again, and I'm just going to echo everybody's, again, believe it or not, I actually do not have a problem with the women's shelter. And as I said before, based on experience that I had with, actually, and when I think about it, actually 2 of my former students had in the shelter. So I actually do not have an issue with the shelter per se, because with all of the men's shelters that we seem to have, I mean, believe it or not, you know, the women need a place to go, especially if they're in an abusive relationship. My only issue is what you've heard everybody said about, and that's the issue that I raised way back when, is the location, location, location. That's my only, not that you're not a reputable provider or anything like that, but
I understand. I appreciate that.
There was another location that was going to be a shelter. Beautiful house. It was on 219th Street. I went to it, and it was 2 houses away from a fish store, and they had the garbage right outside in front of the house, to the side of the house. I went 3 times to the place, 3 different hours, and it smelled of fish. How would you feel having put somebody over there, and all they do is smell rotten fish all day? That is one of the shelters that we said no to. Again, they might have filled it as of right, but they should know what we feel about it. Miss Drinkwater, would you put your contact information or an email that I could reach you at? And I would like to make an appointment to go to that facility myself.
Yes, we will set that up for the board. Anybody who would
Thank you
like
very much.
Absolutely.
That's great. Anybody else?
Yes, I'm sorry. I don't. John, can I ask you a question? Do you know if there is, and I ask you as well, if about the lighting over there, is there any way to increase the lighting? I mean,
So
That
we're,
is
it would almost have to be like you're making a movie. But
an issue, Tolene.
that is something that we would certainly be willing to work with our government partners on,
okay,
whether it be DOT for increased street lighting. I know Ms. Russell mentioned lighting under the elevated track. All of those things are questions that we would be certainly happy to reach out to our colleagues in our sister agencies.
I think we should ask the 47 to provide like between the hours of like 6 and 10, just like increased police presence in the area. That would help a little bit.
So we will also reach out to the precinct because we do have NCOs that sit on the community boards as well. So we believe in partnering with the local precinct and having them sit on the community boards has always been very helpful and something that we will continue to do.
There was a question in the chat about, or a comment that staffing should include an activities coordinator. We do have a full-time recreation specialist on our staffing line, along with 2 vocational specialists as well. It's part of the 60 full-time positions that we have coming into this program.
and Nadia, you do know that we just have a brand new Y that's built, the North YMCA, and that would be Mr. Gaddis. He is the director, Michelle Gaddis.
Thank you.
I just wanted to say, I'm sure you can go to the community board and get a list of resources that can point you in the right direction for all of these services. And even with the lighting, I know that Councilmember Riley can lift that up to the DOT commissioner. And I know the Bronx has a new borough commissioner. I think our old one just left. So, you know, and we've got great relationships between the community board and your electeds. I don't, you know, it shouldn't be a hard lift, big lift.
Okay, if there's nothing else, I'd like to close this meeting. Hopefully in the future, I received an email from a Ronald Downs who is involved with suicide prevention at the VA hospital. I'm hoping to have him talk. I'm hoping to have somebody speak on the human trafficking, and I'm also hoping to have somebody speak on this no bail law. Crime's been getting out of hand, and this happens to be one of the only states in the union that takes away the right of the judge to determine whether or not somebody charged is going to poses a public threat, and the law has to be looked into, as they say. Most people think it has to be repealed. I would like to hear some different sides of the story.
Carl, I'm sorry. Just one more thought came to my head. I know you're ready to close out. I know you said employment at the shelter. Any job postings? Can the community board get an email of that so that we can try to hire from within the community?
Absolutely. And earlier I had said one of the things we're going to do is host a job fair as well in the community. So we will come into the community and host a job fair to make sure that we are actively recruiting. But absolutely, we'll send you all of our postings are through our website, but I will send you a link that has a list of all of those.
Great. Okay, I'm not saying anything else. I'm sorry.
That's fine, Maisha. You know, I'm going to tell you the same thing I told Alfredo. You know, I mean, the more questions you ask, the better. So, you know, that's something that, you know, we were actually supposed to talk about at the last general board meeting, but clearly that didn't happen. So you may need to fill your jobs before we're looking into to see if we can assist with that, because I think, you know, one of the things that we want, to your point, is more home ownership. And so for your clients to actually move into an apartment and then to a home, you know, if they have a job that pays them well, then of course, you know, we would be helping you. And of course, we'd be helping ourselves, because then of course, we would eliminate the need for shelters. So again, not to beat up Deputy Commissioner Drinkwater, because as I said, this time on a personal note, you know, I don't have a problem with, you know, helping these women who, like I said before, if it was anything like what I've seen before, actually this type of facility is needed. So actually I say personally, again, I'm not speaking for the board, but personally, I'm actually in favor of it. I might also suggest to you, and I don't want to put her on the spot, but this woman is absolutely fantastic as far as a resource, and she's the wife of my friend Clinton Mike, Taylor Mike, who you heard. So she's an excellent resource as well. So again, you have resources that are on this call. If I'm you, I would make use of all of those resources. And of course, Ursula Green, who of course is a heartbeat of Community Board 12. So if you really want to get your message out to a wide swath of people, you definitely have Miss Ursula Green's contact information. But again, I'm not speaking for any of these women because they can speak for themselves. I'm just saying, and I'm done.
With that, thank you very much, everybody, for coming and participating in the community. And we will see you next time. Thank you very much. Good night.
Thank you.
Meeting is
Good night,
adjourned.
everyone.
Good night.
Bye, Alita. Good seeing
Bye,
you.
Aisha. Good seeing you
Bye.
too. I'm gonna call you.
Okay.
Okay.
Bye, Carla.
Me.
Bye, Miss Toleen.